A word of caution as we start to wrap up summer and push into the fall. Though we are on the other side of the pandemic, thankfully, doctors are seeing a number of issues catching their attention right now. And it's not all about the flu, though that is on the horizon. Some issues still have to do with COVID-19. First off, the virus didn't take a vacation. Doctors are seeing more infections and more instances of new variants. A CDC advisory panel plans to meet Tuesday to discuss recommending a potential booster shot. The U.S. is seeing more hospitalizations, though infectious disease expert Dr. Anthony Fauci stresses context is key here.
We have a 19% increase over the last couple of weeks in hospitalization, but that's a 19% increase over a very low number. We want to watch it very carefully. I would imagine we're going to see an increase as we get into the fall.
Fauci also suggests the elderly and people with underlying health conditions may want to wear masks again indoors near crowds, but he stresses he's not suggesting a mandate of any kind. Here's the other issue. Doctors are also seeing a rise in another respiratory virus called RSV. It really affects the very young and the elderly, and the CDC is now advising doctors to use immunizations, the new ones now approved for newborns and older adults this fall. But the situation sets up another potential 1-2 punch that we have seen before as we get into the fall and colder months. So here to guide us ahead of what could be a busy season, please welcome back Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control with the University of Kansas Health System. Good to see you again. First off, let's talk about the coronavirus and COVID infections. What's your level of concern right now?
Yeah, I agree with Dr. Fauci. Certainly, I think it is an increased level of concern. We have seen an increased level of hospitalizations. Although the total numbers are quite a bit lower from the last couple years, we need to be aware and need to be concerned about those that are highest risk of hospitalization and severe disease, and that's what we are really monitoring.
How does this vaccine that's available now, not the booster that could be approved soon, but how does the existing vaccine fare against these new variants that we've been hearing about?
Yeah, from all the evidence we have, the new ones, but also the current vaccines, all work towards improving your immune system so that you have a reduced risk of hospitalization and severe disease. And that is true, again, for all the variants that we have seen, as well as for all the vaccines and boosters that we have seen. Now, it depends on the antibodies, the neutralizing antibodies, which do increase and peak, but then go down after about 3 or 4 weeks. More importantly, those vaccines induced cellular immunity, which is mostly T cells, and those are important for helping reduce your risk of hospitalization and severe disease. So we still do have good immunity with the old vaccines or the current vaccine, but also we anticipate with this new booster as well.
And you touch on this. We've talked about this before, about vaccine hesitancy, which is still very much a real thing. Do we really need a booster shot?
You know, I think that is something that we need to discuss with our medical providers and medical teams. There is a lot of discussion between experts with that. I think if you are highest risk of severe disease and hospitalization, meaning you have older age, you have chronic conditions like heart disease, lung disease, you have immunosuppression or cancer, you definitely need a booster. Now, there is some more concern and discussion about those people that are younger who have not as many comorbid conditions or who have had vaccine in the past or even infection in the past. I think overall we need to wait and see what the final recommendations will be. But for most people, I think it would behoove them and be important to at least get this booster for this year and then go on and see what else transpires in the future.
What about masking? You know, it's become such a polarizing issue too. Local senators are supporting a bill in Washington that would try to make mandates illegal through next year. What's your advice to kids, to families, and do you anticipate any more guidance coming on masks?
Yeah, I think you're exactly right. I think with the political nature of this and how it is right now, I don't anticipate any other mandates. I think that is reasonable. I think we all have enough information about COVID-19, about other respiratory infections. And it's important to remember that you as an individual, it is always acceptable and is always okay for you to wear a mask. And it will reduce your risk of infection in general.
Just about using common sense as we get into the fall. We'll leave it there. Dr. Dana Hawkinson, thanks so much for joining us today. KMBC 9 News has you covered with the latest health headlines. Look for updates on air and online at KMBC.com.